My name is Mark Collinson. I'm a psychotherapist and I'm the locality lead for Battersea within Wandsworth IAPT. And I'm going to talk just very briefly about dynamic interpersonal therapy. It's known as DIT, DIT, which is a model of brief psychodynamic therapy. The process would start with an initial meeting with a specialist who would assess with you whether or not this looked like a suitable form of treatment for you. If it didn't look like a suitable form of treatment, we would try to suggest an alternative. The model is for anybody, but specifically probably for people who've struggled with depression and repeated difficulties in their relationships over the years. Many such people have found the model useful. It's a brief model. It's not suitable for everybody. Brief means a weekly meeting over 3 or 4 months. The weekly meeting would be less than an hour, somewhere between 45 minutes and 60 minutes. Psychodynamic means that the past is important and leaves a residue and influences our thinking and our relationships today. During an appointment, you and the therapist would look at your own interpersonal patterns of relating and think about these together. The model is clearly delineated into 3 stages: the beginning, the middle, the end. And the end is especially important because towards the end, you and the therapist would jointly write a goodbye letter where you tried to capture what had been possible during the therapy and to acknowledge what had not been possible. What to do next? If you're interested in what I've said, there's lots of ways to find out more. The main way would be to go onto the internet and search for dynamic interpersonal therapy. There is a DIT website, and the address for that is www.d-i-t.org, and you can also discuss DIT with your GP, and you can refer yourself to our service through the website, making your interest in DIT known.